a man with a really around 5 to 6 inch penis was come and still asking for, saying that he wants a longer penis. Sometimes I feel that should I show mine to say what is normal and what is abnormal? I've seen men, elderly men, even at 70, 80 years of age, masturbate. So that's totally fine. The most common sexual problems that we see is one is erectile dysfunction. And the second most common is the premature ejaculation. After 50, they feel that, okay, it's done. The sexual life is done. But not so everybody. Of course, you need some rest in the bedroom, but there should be some action too in the bedroom.
Welcome to a new episode of Health for You. I'm Chetana Belagere. Today, we're discussing a topic which is often pushed under the rug, but extremely important for the relationship to sustain. This is about sexual health. Sexual health is definitely an emotional issue as well, but there underlies the physical issue also. And to break the silence in the bedroom, we have with us Dr. Pramod Krishnappa, who is consultant andrologist. We welcome you, sir.
Thank you, Chetana.
So this is one topic which I think many people really hesitate to talk about. I think we definitely need to talk about it. There's a lot of silence going on in the bedrooms, is what we've been hearing, reading about. So maybe before we discuss this topic, there's one favorite question of mine which I usually ask all my guests. If not a doctor, what would you be?
Okay, maybe I was always interested in exploring probably a professional guide in National Geographic Channel.
That's interesting.
So I still do a lot of bike trips during my undergraduate days. So we used to go on long bike trips for 3 to 4 days. But now I've stopped it.
Oh, that's very unfortunate. I think listening to people are issues with what is happening in their bedrooms. I think, you must make time for going on your bike drives as well.
Yeah, but I stopped it now. I used to do it during my undergraduate days.
Okay.
So I no more having a bike. So just a car, yeah.
Really unfortunate. So let's probably get into the topic of, when does the silence in the bedroom actually become something which you really need to address? When does it take it as something concerning?
Yeah, okay. So the bedroom is not for only silence. Of course, you need some rest in the bedroom, but there should be some action too in the bedroom. And so people get married, been married since 6 months, 1 year. They've not been able to have intercourse, and then they come consulting for us because the parents or in-laws are asking that you have been married since so many years, why no kids, and so on. So that is one scenario where we get to see patients very commonly. And second is, yes, as somebody young in his undergraduate days, so he has his girlfriend, but they try to meet up and then they're unable to have intimacy, and that is when they come up. And so I, in a day, see approximately around 30 to 40 patients with sexual problems. But most of them, I would say 40% are unmarried, or they may be having a partner. And around 60% are married couples who consult me.
Yeah. So, there are some terms used like, say, silent bedroom, that we call it 10 bedroom. So, what exactly do we mean by that? Is it just that there are no... I know sex is something where there is a lot of societal concerns, emotional concerns. There's a lot of mix of it. So when it comes to physical issues, what are the type of problems that you commonly get to hear in your clinic? What are the problems that come up with?
Yeah, so sexual intimacy doesn't always mean penetrative sex. There's a lot of other things, emotional attachments and so on, foreplay and all that. People always confuse that sexual intimacy means always penetrative sex, which is not so. There's a lot of other things, bonding, emotional bonding and so on. The most common sexual problems that we see is one is erectile dysfunction, which means a person is not getting hard penis for a penetrative sex. One is that. And the second most common is the premature ejaculation. So wherein somebody is ejaculating very early, sometimes even before penetration. These are the two common things. And there are men who come up with saying low libido, lack of interest. I would mainly say that the people who come with a low interest or low libido, the primary cause could be an erectile dysfunction. So they know that there is a problem. If they go to the bedroom, they will not be able to have sex. And that is when they start avoiding that. So that is when they start losing interest. So that is one most common scenario. And sometimes there could be changes in the hormones in the body. like the most important sexual hormone is the testosterone. Sometimes if that declines, or if an hormone called prolactin increases, so these hormones can cause some of the sexual side effects too.
Okay. So, considering that we're all in India, and normally sex is associated with children, right? A reproduction and, So once there is, to have a child, and then there is another child, and then most people think that like the end of their sexual life, probably, don't really people come to you with these issues, saying that there is this problem, or, even that maybe the woman is not interested, maybe the man is not interested. Do they really even come to you with these problems? I'm actually quite surprised that people are coming to the clinic.
Yeah, are you trying to say that after kids, do they come to consult for sexual problems?
Yes. Because if you look at that sexual problem, I wonder sometimes.
Yeah, but I understand the point that you're making. Yeah, so in India, what I've seen is after 50, they feel that, okay, it's done, the sexual life is done. But not so everybody. Of course, when I was doing my fellowship in Spain and Chicago, I used to see people coming at 90 years of age, 90, to seek treatment for sexual health. But here, the elderly patient that I have seen here is around 84 years of age, who has come for sexual health. And yeah, so now the people are reading up and they know whom to consult now. I mean, not the greater population, but I think at least because of this social media, they are trying to find doctors who are dealing with sexual health. Now they know whom they can consult. But still, that awareness is quite less. But yeah, they do come, yeah.
Is that concerning? To see at social media and Google search, to see for who they want to consult is probably a good idea. But then what to do is that, how do you see that?
Yeah, so there are pros and cons of the social media as well. So you pay more and you can come up in the Google ads. So you come as a sponsor, you come as a first place, so if you pay money. But yeah, there are pros and cons. And the disturbing fact that I see is that many health professionals, who are in fact doctors, they say things like masturbation should not be done, this, that, and so on. I am totally shocked to see those statements. See, for example, masturbation is a normal part of a healthy sexuality. It is common. Everybody does it. And for example, a British survey which said that people in the age group between 18 to 45 years, around 83% of the men do masturbate. I mean, the frequency may vary, maybe twice a week or thrice a week, but masturbation is normal. It's a way of exploring their own. Yes, of course, yes, yeah. Since I do mainly treat mainly men, so I feel I'm an expert in the men, and I'll not be an expert in the female sexual health, but yes, of course, yes.
So masturbation is extremely normal. It's normal for both men and women.
Yeah.
This is for our viewers, listeners, to understand that.
Yeah.
And yeah, actually, that was my next question on masturbation. Is there any particular age that you look at when you say that this is healthy, or is there anything of that sort at all? And another thing is, the $1 million question, which many people would probably want to know: how many times a day is okay?
Yeah, so nobody can define how much is normal in masturbation. It all depends on what is your comfort level, whether is it affecting your professional life, your emotional life, and day-to-day activities. If it is not affecting, you can continue to masturbate. I've seen men who masturbate on a daily basis who are doing fine. Some may masturbate twice a week, some may do once a month, and so on. It's totally fine. So no doctor or a health professional can say that, okay, this is normal, you can do this many times, and you are above 60 or 70 years, you cannot masturbate. No. I have seen elderly men, even at 70, 80 years of age, who masturbate. So that's totally fine. It's their own way of exploring their sexual pleasure. So that should be totally fine.
So when does it become concerning?
Yeah, so for example, if somebody is masturbating 3 to 4 times a day on a regular basis, on a daily basis for nearly months together, and if that's affecting, for example, somebody who's preparing for his exams, we see commonly that age group between 18 to 25 years of age, or preparing for 12th exams or whatever, undergraduate exams. So they're in a constant stress during that study period. So that is the time where we commonly see that they come up saying that I've been masturbating a lot. Yeah. 1 or 2 days, it's still fine. But if it is on constantly, they're doing it on a very long-term basis, and they may ending up in anxiety or a depression. So that is when I feel they should consult a andrologist or a psychiatrist to get it sorted out.
What is some of the, I think you've explained in brief on the kind of problems people are they actually coming to you with. But if you look at it, if you could categorize into age groups and the young these days, what are the kind of problems do they come with? When I talk about young, I mean to say about, say, 18 to 30, 25 years of age, what are the kind of problems? And then above 30 onwards, what are the type of problems?
Yeah, so 18 to 30 years, the most common thing is the premature ejaculation, which is early ejaculation, and then of course the erectile dysfunction, when an inability to have a hard penis for a sexual intercourse. But of course, in this age group, it is mainly psychological.
Yeah, that's
Okay. See, in any problem in sexual health, we categorize into psychological or organic. So this age group is mainly psychological, 18 to 30 years, but it doesn't mean that you send them to the psychiatrist. So the moment you tell that, many men, they get offended. Doc, I've come with a genuine problem. Why are you sending me to a psychiatrist? I'm not a mental patient. But there are still that notion that if you refer somebody to psychiatrist, they think that we are referring to a mental doctor and then so on.
Right.
Some of them, they get offended. So we generally do not at upfront refer them. Of course, we do a bit of counseling as an andrologist, and then of course we start on some medication so that the medications are prescribed so that they get good erections or good sexual health, so they get back their confidence, and then over a period of time we are able to stop the medicine. So those medicines are given to just boost their confidence and then to reduce their performance anxiety. So that is one. And 30 to 45 years is when we see something called as the unconsummated marriage. We see very, very often. Yeah.
Unconsummated marriage, even because that things considered as a norm that you get married and then there's sex. I mean, you have a partner and then there is sex. So if you were talking about unconsummated marriages, what exactly it means?
Yeah, okay. So, see, to be frank, I've done my MBBS and then MS General Surgery and then DNB Urology and then subsequent fellowships. So till I completed the MS General Surgery and entered DNB Urology, till then, I never knew that there is a term called unconsummation.
And
yeah, so I totally understand when people say that they don't know what is unconsummation, but yeah. So even many doctors, they may not know this terminology. So since I'm dealing with an expert in this topic, so I know. See, unconsummated marriage or unconsummated relationship means they have been staying together or being married, but not being able to have a penetrative sex. In fact, recently, just 4-5 months back, we published a systematic review article in the Journal of Sexual Medicine, it's one of the top journals, wherein we found that during the paper, we found that the erectile dysfunction in men and the vaginismus in women are the two main common reasons for unconsummation. Okay, so erectile dysfunction we have already discussed. Vaginismus is basically the increased sensitivity of the vagina, female's vagina, because our tightness of the vagina, because of which a female may not let the man to penetrate. So that is vaginismus, and yeah, so these are the two common things. And apart from that, we see sometimes some anatomical abnormalities of the penile structure, because of which, suppose the penis is bent too much to one side, because of which they're finding hard to have a penetrative sex. So this is one thing. And so in Indian scenarios, like you said, that we see couples approaching a doctor when it is the in-laws or the parents, they for the seek of child. When they come to us, we ask them the priority. What is your priority? Of course, most couples, they say that they want to regain or start the penetrative sexual and the conception. So both the penetration and conception may be the priority for some, but there are some who say that, doc, we are happy in our own way by masturbating and we get our own sexual pleasures individually or combined. What have come now is just for the conception. So we may not be active into the penetrative sex, but we just want a kid. So we see that scenarios too, and in that case, we give the option of
percentage. I'm curious.
Yeah, so this is maybe around 10 to 20%. Yeah, yes, they do come. Because this group of couples who come are mainly above 40 years of age. So basically, they would have gone to many doctors and swear, and then the treatments have not helped. They come to us, still we give an option. There are still a lot of options. Anyway, we'll come to that. There are surgical options too, and medical options don't give the improvement. So there are options, but I still do offer the moment we say any surgery for sexual health, many patients, they get scared and then they may not come forward to get a surgery for a sexual health. Yeah. So, so that's how it, yeah.
I will come back to the younger population because majority of the emails or requests that we get to discuss it, so most of them do not talk about it openly. So there are mostly mails which come to being the health editor, and we can ask people to respond to our queries when they have any queries. So the majority of them do ask this question on the size. The size of the penis doesn't really matter. It's not just young, probably even for the elderly who want to know, or does it really matter? Have you come up with those kind of questions?
Yeah, so this is again the second million-dollar question,
Yeah.
and it's a very commonly asked. In fact, the 6-inch size is the most promoted and propagandized. Anyway, so if you see if you see the penile size world map, if you Google, you will get a world map wherein it shows which of the countries have the smallest penis and which of the countries have the longest penis. And so, sadly, that Asians have the smallest penis,
Okay.
and the average is around 3.5 to 4 inch.
Oh.
Okay, and if you see some of the South American and the African countries, they have as long as 7-inch penis.
Okay.
Okay, so people, what they see is for example, Indians or Asians, when they see on the internet or on the phone, they see the penis of the Americans, Europeans, and the Africans, and they assume that they also should have such a long penis. And then they come back to us saying that, doc, so my penis is small and so on. In fact, 90% of the patients who come seeking for saying that they have a small penis, they have actually a normal penis. Less than 10% who actually require treatment. Yeah, so that is one scenario. Second is, see, I consult full-time at any hospitals, and I also do evening clinic at the Orchid, which is on the New BL Road. If you just take a glance on the New BL Road, there are at least 10 to 15 spa centers in that just single road.
Yeah.
And a lot of happy endings happen in many of those spa centers. And then the massage therapist comments that, oh, you have a very small one.
Oh.
So that just one single comment will shatter this guy's emotional thing. And then the very next day they take an appointment and come and meet me saying that they don't reveal this happy ending things. But of course they say that I have a small penis. And so these are the two very common scenarios that we see. Yeah, it's basically a cosmetic procedures. So see, to enlarge a penis, there are two things. One is we need to enlarge the length. Second is the girth. So to enlarge the girth is easy.
Okay.
Okay, there are filler injections, which you must have heard of the dermatologist or many Bollywood stars. They get all the fillers done on the face, like Botox and so on. Yeah. If somebody wants to enlarge the lip or pop the lip and so on, so many fillers that are available, which are safe, which have been used since many years. So that same fillers, we use it into the penis to enlarge the girth. So we use around 10 to 15 ml of these fillers to give a basin size. Maybe we can increase by 30 to 40% of what they have.
Is it or do they have to keep Botox?
Yeah, it's a 1 year. It's a recurrent procedure, so they may have to come back every 1 year and get it done. So that girth enhancement is easy. The length enhancement, we cannot do it with any fillers or something. We need to do some surgical procedures where we can increase the length. So, yeah, it's safe, but again, the length increment, you may get maximum by around 2 to 3 centimeters, which is not very significant. So length enhancement in all men cannot be done. It depends on the case-to-case basis, but girth enhancement can be done in all men, whoever wants to get it done. And these are safe.
Is this, like you said, is this more of, the expectation that is set that is actually, that needs a length enlargement, or is it really needed in some cases?
It's definitely not needed. Like I said, 90% of these men, it's not needed, but they still feel that they want the penis to be big. Just like the cosmetic procedures, what they get it, that it's not that it's affecting their life, just that they want to look better and so on. So same thing in the penile fillers also.
Okay. So, when we're talking about erectile dysfunction, the majority of the problem that we spoke about is of erectile dysfunction. So, is there any remedy for that at all? Like, is there anything, like you said, one is medication or anything else that works?
Yeah, so for the erectile dysfunction, there are tablets. And again, so people, when we prescribe tablets like sildenafil, tadalafil. So people think that the Viagra is something which will cause you heart attack. Yeah. So Viagra is safe, but of course, consult a doctor and take the medicines. Do not try it on your own by taking by from the pharmacies yourself. But of course, Viagra is safe. Somebody has not had any recent heart issues or no previous histories of heart events, you can safely take them. And during my fellowship at the Memorial Sloan Kettering Cancer Center, which is MSKCC in New York, so where many of the Bollywood stars, they all go for the cancer treatments there. So we have seen men who have been taking this medicine since the last 25-30 years. So Viagra was launched in 1998. There are many men who are taking this tablet since then. So it's almost 25-26 years now. So it's definitely safe, but please do consult a doctor whenever you're taking this medicine. So one option is medicines, and then there are penile injections. Something called, wherein there are two types of penile injections, one which we doctors give, which is the P-shot or the PRP injection. The second is the self-penile injection, which the man himself take the injection on the penis at home. I know it may sound a little scary, or a person to take the injection on the penis. Yeah. But these are very small, tiny syringes. So you must have heard of the diabetic patients taking insulin injections 3 to 4 times a day. So when we tell all these things, some men do come forward to take the self-penile injections, but yeah, they do work. And then there are vacuum erection devices, which the patient can use it just before intercourse. And then the last is the surgical option, which is called as a penile implant surgery. Penile implants, the first, they were invented in 1973. It's been 50 years now. 25. Yeah, no doctors, many doctors don't know. I admit that. Yeah. So when somebody in 1980s or 1990s, if somebody had erectile dysfunction, he had only two options: either taking a self-penile injection or the penile implant surgery. Only after Viagra came up in 1998, things slightly changed. So the penile implant, what I'm trying to say is penile implants are safe. I'm not saying that everybody should get a surgery done. But if nothing is working, there is a surgical option also which is safe, and it has been there since the last 50 years, and it is very effective. Okay. So penile implants, again, there are different types, semi-rigid and inflatable implants. So wherein it depends on, we decide which is best for the patients depending on the patient characteristics.
Okay. It's like we discussed on, masturbation at the timing also. Is there anything like that for sex as well? Like, is it like, okay, once a day is normal, that's the normal, so people have not had sex for like months together, that is funny. And there are so many questions that people do come up with. Some of them ask, whether, somebody's not had sex for like, say, 3 months, then after that is it okay to have sex? Is there anything? So there are many questions and doubts around the frequency of sexual act. So is there anything of that?
Yeah. So there's no standard to say what is normal in the frequency of intercourse. But the most common question, this common question is mainly asked by couples who are trying to conceive. They're going through infertility, and then they want to know what time is the best to conceive and all that. So for them, what we advise is, suppose the wife's or the woman's periods is from 1 to 5 days. Example, I'm just giving 1 to 5 days the period, and from the 8th day onwards, have alternate day sex for the next 10 days. Okay. We can say daily, you should have daily sex, but that may be slightly demanding, or everybody may not be able to have sex on a daily basis. The more we say that, then the performance anxiety starts, and then the man may start losing his erection because that, okay, now in the workplace in the evening he starts thinking, oh, now tonight I need to go and I have to have sex, otherwise my wife's going to feel bad and so on. So to reduce the anxiety levels, we say 1 to 5 is the periods. From the 8th day onwards, try to have alternate day sex for the next 10 days, so that the chances of conception will increase, because the wife usually ovulates or releases the egg usually on the 14th day. Okay, so that is for the couples who are trying to conceive. But otherwise, it depends. There are people who have some stress at the workplace, or they lose a job, they may not be able to have sex, or they may not be interested to have sex. So it's okay. It's okay. It doesn't mean that if they resume sex after 3 months, it's going to affect them and so on. There's no such a thing. But we always say that, any muscle which is not used can become atrophied. which means, so I see somebody wants to work out and build up the biceps muscle, so they need to work out and then build those muscles. If we don't use them, maybe over a period of time, 6 months, 1 year, the muscle will shrink in its size. Okay, so same thing, that's why we tell men that you need to either masturbate or be sexually active so that your corporal smooth muscles inside the penis are in a good shape.
Actually, in discussing, suddenly this question came up on andrology itself, Not many people are aware of this profession also. They know a urologist, but I don't think many people know about andrology. I guess out of the blue, but it suddenly occurred to me that actually we should probably touch upon that as well. What exactly is andrology? Also, how rare is that profession in India? I'm not sure whether there are any doctors.
Yeah. So see, a urology is basically that covers from the kidney.
Yeah.
Kidney, ureter, there's a small tube, and then the bladder where the urine gets collected. And then it comes out to a pipe called urethra, and then the penis, and then the scrotum, that is the testis. Okay, and this is what the entire urology deals with. So when it comes to andrology, it mainly deals with men's sexual health and male infertility. So you may tell me that, Doc, how are you different from a sexologist?
Yeah.
Yeah, okay. So sexologist can be anybody who deals with sexual health. So it can even be a non-doctor who has done probably an MSc psychology, who may counsel the couples related to sexual health. So even they designate themselves as a sexologist, or somebody may be an MBBS doctor who treats sexual health, well, he can be called as a sexologist. For somebody to be called as an andrologist, MBBS, MS General Surgery, DNB Urology, and then you should have done a fellowship in andrology to be called as an andrologist. And to tell you frankly, in the entire Asia, there is no andrology fellowship. Okay, very recently in Australia, they started an andrology fellowship of 2 years course. But that's why when I started my andrology fellowship in 2018-19, so I had to go to Europe and the US to get these fellowships done. So it's quite a rare thing. So urology has many subspecialties. So it could be pediatric urology, reconstructive urology, endourology, deals with kidney stones and so on. And then there is an andrology, which is one of the upcoming subspecialties of the urology. And there are very, very few, to be frank, very few andrologists in the entire country. And mainly, so the difference between sexologist and andrologist is sexologist usually does counseling and the medicine part. They don't do the surgeries. So andrologist, of course, some amount of counseling, medicines, and then there are surgical options which can be done to treat the sexual health problems. So that is what we andrologists do.
Right. Thank you very much. I really needed to understand this first. So I'm coming to, lifestyle is kind of causing a lot of these diseases. So there are many diabetes is one, which is hypertension. So lifestyle is getting more everywhere. So does it actually also affect your sexual health?
Yeah, see, if you put out textbooks or any guidelines, the first thing always mentioned in the management part of any disease or any problem is lifestyle changes. Of course, when it comes to sexual health, smoking definitely has a significant impact on the erectile dysfunction. So we always advise to cut down or stop the smoking. And also it has a significant impact on the male infertility too, that is on the sperms. So smoking definitely has a significant impact. So we tell them to reduce it, but not everybody listens to us. And then second is alcohol. See, alcohol, mild amounts, probably social drinking once in 2 weeks or once a month, that is still okay. As long as somebody is not taking it on a daily basis or an alternate day basis, that is something wrong. Yeah, occasional social drinking is fine, but smoking completely no. And then, of course, the sedentary lifestyle, work from home concepts are, to be frank, are not a good concept. Suppose if you're doing that, you should make up at least 1 hour time in the morning hours so that you go for a jogging or join some classes, whatever, the gym or something. You need to do some physical workouts to keep your body healthy. Yeah, so those are the important things. And of course, if you're obese, if you're above 90 or 100 kgs, make an effort to lose at least 5 kg weight loss. I know it's difficult. It's easy for me to say, okay, lose 5 kgs. But yeah, we have seen that men who are made or women who have made those significant effort to put significant efforts to lose weight by at least 5 kgs, we have seen significant spontaneous improvements in their sexual health and in the fertility as well. Yeah, so weight loss, regular exercises, and exposing yourself to the sun for just 5 minutes, which is also very important because vitamin D is very much important. Since most of us work indoors, we hardly get exposed to the sun. And a lot of sunscreens the women apply, and you're basically blocking all the benefits of the sun. Of course, sun has some side effects, the sun rays has side effects too, but at least exposure for 5 minutes in the early morning hours or by around 10 a.m. is actually good.
Okay.
These are the lifestyle changes we do advise. Of course, food. The foods which are rich in antioxidants or carotenoids are very good for sexual health. And so what we commonly suggest is some fruits which basically citrus fruits, which has more antioxidants like oranges and lemon, mosammis. They have a lot of antioxidants. Pomegranate, beetroot, and walnuts. So they have a lot of these carotenoids, and they are rich in nitrates, which may help in the treatment of some of the sexual health. But some of the men, they take the impression that just by eating things will improve. Because the first thing they ask is, what can I eat to improve sexual health? Eating alone will not help. Of course, eating, and you need to do all the other things which I said now.
Right.
So if you do all these things, yes, we do see some improvement. And if they don't work out, then there's always tablets and other options which we can always explore.
Right. So for people with diabetes, is there something concerning for them specifically that, their sexual health may actually deteriorate? Is that from that? So?
Yeah. So diabetes, basically in diabetic men, many of these blood vessels can get clogged. Basically atherosclerosis process. It's a very common process that happens in all men, even those who don't have diabetes. But in diabetic men, it is slightly happens at a faster rate. So the penis has very small, tiny blood vessels which carry blood to the penis, and many of these blood vessels can get clogged. So because of which the blood supply to the penis may reduce. And there is a smooth muscle inside the penis in a compartment called corpora cavernosa. So these smooth muscles may become slightly rigid. They may not work the way they should work, because of which again people may face erectile dysfunction. And there is a condition called Peyronie's disease, because of which there is abnormal block formation in the penis, because of which the penis starts bending to one side. It may bend as high as even up to 90 degree. So imagine something which is 90 degree bent penis, and of course they will face a lot of issues for sexual health. So then we'll have to treat them accordingly. So diabetes does make a lot of impact on the sexual health. So that's why they should aim to keep their HbA1c level in the range of at least 6 to 7 range. HbA1c is the blood test which is done to check the last 3 months average sugar level. So aim at keeping it between 6 to 7.
Okay. So, when we're discussing these symptoms, like when do people actually come to the doctor? When do you know that, okay, this is the time for me to go to the doctor and check? So, is there anything that they have to watch out for any of these sections?
Yeah. So, anybody with sexual health issue, you have tried all these lifestyle changes, you have tried for 1 month, 2 months, not working out, your relationship with your wife or with your partner is affecting you now, it is started taking its toll, then it's probably time that you need to consult a doctor. So I would say 1 to 2 months of lifestyle changes not helping, please consult a doctor.
Okay. I think that's the simplest advice to give, because I'm sure you all know it very well. So, Dr. Coming to, all these, treatments you have said already. First of all, this whole thing about talking about sex itself is still a taboo in India, and then considering the treatment options which are, we have just described on how it is. Is it really expensive, and how much of it will be when the insurance? So how much role does an insurance play in this particular sector?
Yeah. So the sad part is the insurance does not cover any of the sexual health treatments in India.
Oh.
Yeah, that's a really sad thing, because when I was working in the US and Europe, most of everything, including sexual health, whatever the tablets, including the surgeries, are covered under insurance. In India, it is not. So the patients have to pay from their pockets. And yeah, see, India, if you have money, you can meet 10 doctors in a day. Okay, whereas in the US, somebody had to wait for 3 months to get my professor's consultation in the US. So Indian healthcare, to be frank, is very accessible and not very expensive. Okay, so for example, a simple Viagra tablet, which is a generic sildenafil tablet, may cost just 15 to 20 rupees. So it's not very expensive, whereas the same Viagra in the US will cost $25 to $30, which is around 3,000 rupees. So definitely these treatments are not very expensive, but yes, you may have to take it on a slightly longer duration depending on what the cause of your sexual problem. So definitely it's not expensive. And sad part is that insurance doesn't cover any of these things. Even though you have the best premium insurance, it will not cover the sexual health treatments. Yeah.
I just have like few, if you want to call it rapid fire, you can, or if you want to call it patience questions, we could do that as well. So probably this is something, which many people want to know. Weirdest myth about sexual health you have ever heard?
Okay, so people think that there's something called That syndrome, DHAT, That syndrome, wherein it's described mainly in South Asian population, where people think that if they ejaculate, they're going to lose their manliness, they're going to have hair loss, they may not be able to father a child in the future. So this is something really, shocks me all the time when people tell this. Yeah, that's the weirdest. Yeah. Then it's described syndrome. It's called That syndrome.
I still have a stage. So one thing you wish everyone knew about sex?
Probably usage of lubricants. I would say that, elderly men are also sexually active, but many times the females, because of the hormonal changes after menopause, they may not be having enough lubrication in the vagina. So it's time that elderly men should educate the women or tell or you probably use a lubricant during intercourse. I know maybe it's a serious talk, but using a lubrication is a must in men who are, in couples who are having sex above 50, 60 years of age.
Nothing does. Yeah. So what's your go-to advice for a happier sex life?
Yeah, so there's no frequency for this. Happier sex life probably take some trips. I at least go once in 3 months. I just take trips. I go to my fancy places and I visit places. And so try to be comfortable and explore. There are many ways to explore the sexual intimacy. Work out what suits you better. And there's no doctor who can say that this is what you should do and this is the only thing that you should do. Explore your own ways of exploring the sexual intimacy, but make sure that you're doing it in a proper hygienic way. That's all I say. Yeah.
So what's the most awkward moment you have had as a doctor?
So we discussed about the small penis.
Yeah.
Sometimes though, a man with a really around 5 to 6 inch penis was come and still asking for, saying that he wants a longer penis. And then sometimes I feel that should I show mine to say what is normal and what is abnormal? People with even probably a smaller penis also are sexually happy and they are doing fine. Yeah.
It's very interesting. So this is my last question. If you could tell your younger self one thing about sexual health, what would it be?
Sorry, can you repeat that? Yeah.
If you could tell your younger self one thing about sexual health, what would it?
Probably protection is something very important. And anyway, happy endings may not be good at all the time, so be careful. Because we are seeing a lot of these. HIV is no more a dreaded disease now. HPV, human papilloma virus infection, wards are becoming very common. In fact, the vaccines have come up for both men and women. But the thing is that they need to take it before they become sexually active.
Right.
So that is something I would suggest for young women or men who are still not sexually active. Probably it's worth taking the human papilloma virus because that can cause a lot of cancers in women and men. So that is something which I would like to stress in this. Okay.
Thank you, Doctor. I think it was wonderful talking to you. And is there anything else which you think that we should discuss? If there is anything we could still,
Yeah, I think probably we discussed most of these things, and I'm very happy that you came forward so that a special podcast could be done to concentrate on main sexual health.
Yeah.
Thank you very much, Chetana, for this.
Thank you, Doctor. Thank you, Dr. Pramod. This is it. I think, I'm sure, whoever has seen it, heard it, know it all now, went to see a doctor and what is the normal size and when you have to really fret about it and then not to fret about sexual health. That is all we have for today. Thank you so much.